A lot of the issues that we were facing was because of lack of planning earlier in development and in clinical trials.
You need to know where your patients are, and you need to know where your experienced doctors are. Previously, when we would receive a request for proposal from a company that was looking for a rare disease partner, it would bring instant stress. Thinking about my Workday now, I can get any question through the door and I can have an answer for my clients or my internal team members in 15 minutes.
In less than 5 minutes, I can have a great starting point. Having TrialHub feels like having an additional team member.
I started working in clinical trials right after I had a job at a pharmaceutical company talking to patients in a customer service call center for a multiple sclerosis product.
So I actually started in clinical trials through the early access space, and I quickly got involved in post-trial access, real-world data collection, and I realized that a lot of the issues that we were facing was because of lack of planning earlier in development and in clinical trials. So I shifted towards clinical trials to understand what went into it and the different parts of the puzzle and how it all fits together.
You need to do your research before you do your clinical trial research. You need to know where your patients are, and you need to know where your experienced doctors are, because you don't want to spend time approaching sites or regions where you're not going to have success in reaching those patients that truly need the drug.
So the one piece of advice I would give to anyone starting a clinical trial is to talk to your community that you're trying to help. They're the experts in their condition. They are the ones living with it day in, day out. And the earlier you bring them on, the better. They'll give you invaluable insights and you will save everyone a lot of time, whether you're the regulator, you're the pharmaceutical company, you're the physician, the hospital. You'll save time and money because you know you'll be going in the right direction right from the beginning.
Previously, when we would receive a request for proposal from a company that was looking for a rare disease partner, it would bring instant stress because regularly we receive proposals for diseases that I've never heard of. I don't have that expertise. Luckily, within Bionical Emas, we have rare disease expertise within our medical affairs team, and I can take TrialHub and I can partner their patient-focused experiences and what they know about what these patients go through with the TrialHub data on rare disease prevalence, where we can find these patients, what countries would be great to go to, as well as what drugs are already approved within those countries for those patients. So then we can partner internally through the use of TrialHub to really put together a concise, focused proposal that speaks specifically about these patients.
What has been super helpful using TrialHub is having recruitment rates, because that alone can take hours depending on how complex the disease is and the kind of patients that you're trying to recruit for your trial. That could take at least sometimes half of the time in the feasibility work would be finding the right recruitment rates.
Thinking about my Workday now, I can get any question through the door and I can have an answer for my clients or my internal team members in 15 minutes. Having data that backs it up, having critical pieces of information that I can share with them at a moment's notice. I can pull reports, I can pull visuals, that stress is gone.
Thinking about a day-to-day, with the breadth of information I have to gather, especially for proposals, having TrialHub means that in less than 5 minutes, I can have a great starting point and cover lots of information, whether it's clinical trials, where are the sites, where are the experts, where are the patient groups. And normally it would probably take me 2 days to gather all that information, but now in a day, I have a really good idea of where we're going, what we need to do, and the best recruiting countries. In my role, what's really key is that I combine the information that I get from TrialHub and the patient insights that we get from the platform with the insights that we get from the patient advocacy team and their outreach with the groups. And combining that makes our insight even richer and even more complete. And when we present that to the client, they know that we've gone to the extra lengths to understand what actually is needed and what will be impactful and how their trial should look like, what kinds of extra support they can provide to improve recruitment and improve retention. And so having both sides, from the TrialHub side and directly with the groups, just makes that job a lot easier.
Another way TrialHub really helps in our proposal process is it gives us the ability to run multiple scenarios and pull out the data that is critically important. For example, we had a client who gave us 2 different options for enrollment timelines, and we were able to say neither of these are what we would recommend. And we could provide them with graphs that showed what their startup timelines were going to be against their enrollment rates in their countries. And so we actually gave them 3 scenarios. Your 2 we don't recommend. Here's why. And it was related to enrollment rate, and the countries that they selected. And instead, we were able to back up the data that we pulled with a different graphic that said we would recommend doing this because this is achievable. It extends your timelines, but it's way more reasonable of an enrollment rate. And it's important to be able to give your clients that level of detail and thought so that they can trust the data that they're seeing and the delivery that we're committing to.
Honestly, having TrialHub feels like having an additional team member helping us in the research, especially for the proposals, and saves a lot of time and makes working with Stacy and her team a lot easier because we don't work in silos, we work with the same platform, the same tool, we're talking about the same thing, and if one of us is off, we can cover for the other person, and we don't waste any time trying to understand what they found, what I found, what the other person's found, because we're looking at the same thing.